know you mentioned before that you started on the cardiothoracic and now you're in public health, right? How was
Mm.
that transition for you? And where did you have any mentors?
Oh, that was a long, it was a hard transition because when I was in ICU, I had a spine problem. I it um, broke my L4 and L5, and I've got a congenital defect of my spine. I didn't know that one, and then I ended up in ICU lifting all these more than 5 kilos life care pumps that aggravated my spine. So I ended up having a surgery, which requires me to have an incision front and back, the anterior and posterior interbody fusion, and had the pedicle screw. So the hospital advised me that it would be better if I go and look for other avenues instead of working as an ICU nurse. So that was in 2014. And then during my recovery, because it takes 1 year, 6 months to 1 year for the bones to fuse to the prosthesis. So during those time, I was advised to go and have a rest, but I was so adamant. I was so worried about my future. I study, went back to school, although I went against the advice of the doctor, because you know how when you go and have your spine surgery, you're not allowed to stay in one position for 30 more than 30 minutes. So the surgeon was saying, how would you do that if you're going to school? You'll be sitting down more than 30 minutes. And so what I did, when I did my study, I said to the professor, to the school, that I said, my wounds are still fresh. And if you see me standing up every 5 minutes, that doesn't mean I am walking out or a disrespect. It's just because I'm not allowed to go and sit for a long time or stand up for a long time. So I was like doing that for the rest of my study. And so I took up a course, a postgrad course for immunization, which also handle, I mean, touch the topic of immunology, science, epidemiology, stuff like it's completely different. It was really out of my league because it's more on public health. So I said, okay. So that's what I did. And luckily I passed. And that's where the path I am right now. Yeah. Yeah, the neurosurgeon was really shocked because sometimes when I go home and do my case scenario, there's always the Australia loves case scenario. Oh my gosh! So every time I go and do my paperwork, um, I would sometimes go to talk to my teacher online, and I'm like, in the bed, lying down and doing like this. And then the teacher would say, oh, are you in bed at the moment? Yeah, I am in bed. So are you okay? Yeah, I am okay. Because sometimes, I have to change position. So I was in bed, and then they all know. They all know that I just had a surgery. So they are very, you know, they tolerate me. They understand, and they help me all the way. They helped me through my studies. So they're very supportive actually. So yeah, I'm so lucky I finished it. So yeah, so after that one, I started working as in in clinic. I work in clinic, and I'm the one who's handling the immunization. And then after the clinic, I went and did my I work in a community. That's where the big job is. I started having my own vaccine at home. I have my own clinic. Yeah. So I keep my vaccines at home. I work independently. I go from one community to another. I maintain my cold chain. I have my data loggers. So yeah, that's how up to this time what I'm doing. So now that I'm doing the COVID vaccination, what we do is um, the federal government assign people to go and put up a hub. Excuse me. So put up a hub, and we go from one place to another, and the we have this portable fridge with us to maintain the cold chain. Because you know how when you remove the Pfizer, when you thaw it, it's good for a certain amount of days. So that's what we did at the moment with the COVID vaccine.